Hi class, today I will be talking about borderline personality disorder and DBT treatment. I actually got a whole bunch of colored pens for this assignment, but then decided that the best color scheme would be just a black and white color scheme, because a lot of the time people with borderline personality disorder often think in black and white, which is either the good or the bad in the situation, and there's no in between. So I actually chose this assignment because I have BPD. Another reason I decided to pick, BPD as my topic for this assignment is because of the stigma behind it. And not a lot of people, have taken the time to learn about BPD and really understand what people like me and other people, go through on a day-to-day basis. People with BPD are considered untreatable, which isn't the case. And then because we're considered untreatable, we're considered hopeless. And to be told that you're a hopeless case is really, devastating to a lot of us. And because we're considered hopeless, we're really pushed around the system, and basic, therapies don't often work on us. And because of this, we're considered, horrible people, which just isn't true, just because I have, a harder time dealing with my emotions and, trying to figure out who I am as a person, doesn't make me a bad person. It just means that I need a little extra time, than other people do. So BPD stands for borderline personality disorder, like we know, and DBT stands for dialectical behavioral therapy, which is the most effective therapy for borderline personality disorder. Some of you may have also, read about or know about CBT, which is similar to DBT, but focuses more on thoughts and feelings, behaviors, and how they can depend on each other, and how to find a perfect balance between those things. DBT focuses on the same things as CBT does, but also emphasis is put on regulating emotions, because a lot of the time we have difficulties differentiating between our emotions, and also being mindful that sometimes the things that we're feeling also affect other people, and learning to accept painful things that we cannot change, because a lot of us have abandonment issues, which is a huge thing in borderline personality disorder. So like I said before, people with BPD typically have unstable moods, behaviors, and relationships. In the DSM-V, which is the book of diagnosing almost any personality disorder or disorder, the criteria for diagnosis is as followed: abandonment issues and unstable relationships, identity disturbance, impulsive behavior, recurring suicidal behavior, emotional instability, chronic feeling of emptiness, which is why a lot of us also have depression on top of our BPD, and anger. Some evidence that DBT helps improve quality of life is Hunter DBT Project, a randomized controlled trial at DBT on 73 women with BPD to see how it improved quality of life. So like I said early on in the video, controversies with this topic are people with BPD are untreatable, and that's not necessarily the truth. We wouldn't have things like DBT in place to treat disorders like BPD if they were considered untreatable. However, we are a little bit harder to treat than other, people with mental illnesses, and that's okay. It just takes us a longer time. Unfortunately, there is a large group of us that give up and, start doing drugs and things like that, and I like to think that I've done a really good job with keeping my BPD in check, and that, I can be a role model for others dealing with the same disorder to do something about it. So what I really hope that people learn from this knowledge that I've provided about BPD is, being stigmatized is really hard. It affects us and it affects our treatment, and it wouldn't be fair for, somebody to label or stigmatize you, whether it be, about your mental illness or about the color of your skin. Being labeled is not fun. And, I think it's only fair that if, people with BPD have to, learn to be mindful about things that we do and things that we say, that it's only fair that other people do as well. And that's the takeaway. I hope people, really understand. Anyways, thank you for watching, and I hope that you have learned a little something from my video.